Welcome to another episode of the Bleeding Edge of Digital Health. Today's conversation is going to be centered around sudden cardiac death. While I was doing some research for this episode, I came across some pretty interesting statistics that I thought I would share. Sudden cardiac death is the leading cause of death in adults over the age of 40. In the United States, every year, roughly 400,000 people and 23,000 school-age children die of sudden cardiac death every year. And every minute that the heart goes without beating, there's a 10% reduction in the chance of survival. So with that as a backdrop, I'd like to welcome today's guest, Samir Joffrey, CEO and founder of Avive Solutions. Samir, thank you for joining me today.
Thanks, Mike. I appreciate you having me on.
Yeah, absolutely. So why don't we get started? Why don't you introduce yourself? Tell us a little bit about yourself and Avive, and then we can kind of jump into some questions.
Yeah, nice to meet you all and be here. My name is Samir. I'm one of the co-founders and serve as the CEO of the company. And in my background, very briefly, actually, interestingly, started on the nonprofit side of cardiac arrest prevention. So cardiac arrest is a topic that has touched my heart for a long time, since I was actually in high school. And so it's something that it's a problem, I should say, I've been really deeply passionate about for over 10 years now. And when I got to college and did my undergrad degree at UCLA, I actually started a nonprofit that really focused on preventative cardiac screening for student athletes before they played in sports. So if anyone here watches sports or anyone listening watches sports, and you might have heard what happened to LeBron James' son as an example at USC when he was playing basketball for the NCAA team. And what we're trying to do, or what we were trying to do at our nonprofit Saving Hearts Foundation, was prevent that from happening, right? And we would do that by delivering free EKGs, free echocardiograms for youth before they played in their high school sports year. And grew that to be a really successful foundation. It's how I fell in love with healthcare, was the lives that we impacted through doing that. And eventually we actually expanded the scope of that nonprofit to help build AED programs, or help the greater Los Angeles community build AED programs in schools, in community centers, and parks and rec facilities, faith-based organizations. And that was really my start and introduction to this world of automated external defibrillation and how you actually respond to a cardiac arrest emergency, not just try to prevent it from happening, right? And that led me to ultimately our journey here at Avive, and was fortunate enough to meet my co-founders through a series of events, and here we are today.
So Samir, there's several AED companies out there. I think there's 4.5 million units deployed in the US alone at present, but they're only being utilized 2% of the time. Why does this problem still exist?
It's a great question. And maybe it makes sense to start with a little bit of history here and context, right? So public access defibrillation in its current form, where you have a highly portable, or more portable, I should say, automated external or AED, or automated external defibrillator, or AED, really came to the market in kind of the mid 90s. There was a company called Hardstream that brought probably the most portable AED at the time to market, and that's actually now part of the Philips product line. And ever since then, there's been a really wonderful job done by manufacturers and distributors that they partner with to get broad proliferation of AEDs throughout the country, right? You mentioned it, Mike. There's well over 4 million AEDs, 4.5 million AEDs deployed throughout the United States. And they're saving lives, to be fair, right? And when you get an AED to a patient quickly, as you mentioned, and can deliver early defibrillation to a patient in the earliest, most critical moments of a cardiac arrest, you got a great shot at saving someone's life. The problem is that you mentioned, less than 2% of the time are we actually getting an AED to a patient's side. So you have this really interesting dynamic where the install base and growth in the market of AEDs being deployed into communities is growing every single year. So there's a really nice CAGR in the industry. You could say 6, 8, some years 10+%. But survival rates are staying flat. And it's again not because the therapy doesn't work, defibrillation is incredibly proven. It works, but the key is the delivery of the life-saving therapy, Mike, to actually get to a patient in the earliest minutes of a cardiac arrest. And we haven't addressed that problem yet. We've addressed getting AEDs out there and making them more accessible, more known, the public more aware about them, but we haven't solved the actual problem of getting it actually utilized on that patient more quickly and more often. And I think the large reason for that, Mike, is a lack of connectivity and interconnectivity and integration of the AED effectively into the system of response for a cardiac arrest emergency. And we need to make the AED a centerpiece or a key piece of the chain of survival. And today, we hope it gets there, and we need to change that thought to how do we get an AED there almost every time before EMS arrives on scene. And I think that's the paradigm shift or the thought shift that we need to take in the industry today.
Yeah, I mean, there's some big players in this space, but the technology's gone pretty unevolved. It's been, there's been a lack of innovation in this space really since the early 2000s. What what do you attribute that to?
I think it's like a lot of problems in healthcare, right, Mike, where um, companies are doing well in the space, right? They're growing market share. They're continuing to grow the product line, and revenue continues to grow. And there's not a lot of impetus for change. There hasn't been a new player enter the market since the early 2000s. We
Hmm.
at Avive were the first new company to enter the US market and achieve an FDA approval since 2003. And so I think when you have that stagnation and there isn't this competitive energy to continuously push each other to innovate, because there's almost this detente, like we're all doing fine, let's keep growing our share in the market. We'll come out with a few features that we could sound like they're improvements, but we're not really addressing the core problem here. I think that's been the status quo right across the industry for a long time, and I think it needs a jolt of competition and new ideas, new thinking, to really reinvigorate innovation in this space, and on a problem that it's sorely needed, right? You mentioned how big of a public health problem this is and a healthcare problem this is in the United States. I mean, for it being one of the leading causes of death in the US, it probably gets the least emphasis and focus from an innovation standpoint, and we're really trying to change that at Avive. And Mike, I think another barrier to more continuous and rapid and frequent innovation in this space is, in all honesty, the regulatory pathway is tough, right? It's a class 3 PMA device, and understandably so. It's a life-saving device. It needs to function and work. There needs to be that level of rigor. So no complaints there from me for this to be classified as a PMA. But I think that does um, sometimes deter folks from wanting to put forth the investment required to get through that process to bring out something truly innovative or a new age product. And but I think that hopefully, with new entrants coming into the space like ourselves, we can force companies to start making that investment and thinking about how they can continue to improve their products so we can keep this being a competitive space.
Yeah, yeah, it's interesting because it's a class 3 device PMA, but it functions like a consumer device, right? So it's a really
It's a
unique
very interesting,
technology.
absolutely. It's super unique from that standpoint where it is a class 3 PMA, but we are asking an oftentimes an untrained bystander to pick this thing up and use it in minutes, if not seconds, without any prior training, right?
Yeah.
And that is the challenge. And what we are burdened with as the manufacturer is we have to design a product so usable, so easy to use that I could hand it to you and you could figure it out in possibly the most stressful situation of your life. Someone is clinically dead in front of you. Uh,
Hmm.
and so it's a fun challenge for sure.
Yeah, yeah. So you've mentioned a couple times that there's been stagnation over the past 20 years in terms of survival rates. How are you guys using modern day technology to solve that problem to improve outcomes?
Yeah. So I think at the core of what we do is we are building a connected platform. And at the core of that platform is you see right behind me, the Avive Connect AED. It's our fully connected AED with cellular, Wi-Fi, and GPS. And that enables us to do a whole bunch of things that haven't been really explored in the AED space in terms of how we could rethink response to cardiac arrest emergencies. Mike, the status quo is if I were to collapse right here, and I don't want to jinx myself, but if I were to collapse, hopefully, Mike, you're going to call 911 for me and be my friend and help me out. And when you do that, on the other end of the line, the 911 telecommunicator is going to ask you a series of questions. They're going to ask you, is the patient responsive? And if you say no, they're going to ask you then, is the patient breathing normally? And if you say no to that, they automatically assume cardiac arrest. And Mike, the next question they're going to ask you is there an AED nearby? And Mike, I guess I'll just ask you, what would you say in that
Don't
situation?
know. No clue.
Oh, no, right? And you're not alone in that response. The vast majority of people in the United States respond exactly that way. Now, think of that paradigm. Your subject matter expert, your first responder, the 911 telecommunicator, the only help you've got until ambulances, fire EMS arrive on scene 8, 9, 10, 11, 12 minutes later in that emergency, they're asking you where the life-saving therapy is.
Right.
And that doesn't make a whole lot of sense to us, right? And so it really starts there. It starts at the front end of the emergency. The 911 center is, I think, an absolutely critical stakeholder that this industry has not supported well enough to be able to get the life-saving technology, an AED, to a patient in the earliest minutes of a cardiac arrest. So what we do, Mike, is we actually, through the connectivity in our AED, that supports an ecosystem or a connected platform where we have software solutions that integrate with 90+% of 911 call centers in a country, such that when that same call comes in, they can actually press a button to activate a network of our AEDs nearby, and those AEDs can alert and have a map taking you from where you are to the location of the patient across the street. So instead of them asking, Mike, is there an AED nearby? That can become, I'm sending you an AED, Mike.
It's a bat signal.
There you go.
Yeah.
And that is, I think, a key missing piece of the puzzle of how you can actually solve the delivery problem of the therapy and getting AEDs to patients more often than the 2% status quo that we've had for 20 plus years. So we're trying to leverage connectivity to not only connect into the 911 center, but we also want to make sure we get data from that AED downstream to first responders as they're en route. So they actually have great situational awareness to what they're walking into. Today, they walk in to a cardiac arrest drinking from a fire hose. It is chaos. There's no data. It's all subjectivity. I think this patient was down this long. We tried CPR. I think we delivered a shot. A lot of I thinks and very few I knows, right? And we want to get the right data from the AED to first responders and then downstream to the hospital. So they have it before the patient even goes through the two front doors of the emergency department so that they can then plan for the right care plan for that patient so that we can get them home back to their family ultimately.
And
And
all of that cycles through from the AED wirelessly to the hospital
you're right.
or
Right. Our cloud connected platform, the AED communicates there, and we're able to funnel it to the right place at the right time during a cardiac arrest. And that's really where we think that we can actually start to solve this problem of let's get the life-saving therapy to the patient when it's needed, where it's needed, and then the right critical data to the key stakeholders involved in a cardiac arrest, 911, fire EMS, and the downstream healthcare providers at the hospital that are going to deliver advanced care for that patient.
Wow, that's impressive. How does, and forgive my ignorance, but how does it work now with an AED? Is it just basically it shocks and that's it? It doesn't gather any information. It doesn't, none of that information goes to the hospital with the patient, so to
Yeah.
speak.
So I think there are AEDs all store data and information today, and so any of our competitors' AEDs, you would be able to grab data off of them, but it's often a very manual process.
It's
you
too.
have to get like a specific cable and specific software, and it's a very cumbersome process, such that Mike, it often doesn't happen.
Yeah,
Now, there are some the newer models of AEDs from a couple of our competitors that have some limited or more limited connectivity, and they are starting to move in this direction of being able to more rapidly or efficiently share data from the device. But I think one of the key things that we do from a differentiation standpoint is that we have built this connected platform such that we can be sharing data all the time between all these key stakeholders in a robust set of data that and integrate into groups like 911 such that we can activate AEDs in real time in a way that just isn't being done and can't be done by our competitors today.
that's incredible. Really exciting. Exciting for everybody, really, because who knows who's going to be the next patient, right?
Cool.
Um, so this industry, if I'm not mistaken, has been pretty much dominated through distribution, independent distribution, right? Which in and of itself is seems concerning, considering it's a life or death technology. Um, are you guys approaching that differently? And if so, what challenges and opportunities has that presented?
I think that the way that I think about this is distribution partners for manufacturers today honestly have done a pretty wonderful job of making AEDs more accessible. We would not have as much proliferation of AEDs that are as there are out there if distributors, national distributors and local regional ones, had not put in the effort and been the boots on the ground to go get that level of dissemination throughout the country. So I think they deserve a ton of credit from that standpoint. I think that the way we think about this, Mike, is when you're trying to deploy a paradigm shift in how you think about responding to an emergency like a cardiac arrest. I think that when you're establishing yourself as a brand, you're establishing what that paradigm shift looks like. I think it's often best that you communicate that message directly to the end customer and end user, right? Because in some ways they don't really know what that vision could be and what that vision could look like and what that new way could be. And your our job is to communicate with our communities, our partners in communities across the country as to what a new way could be. And I really think, Mike, that there is a world where we do work with some partners today for certain market segments where we think it makes a lot of sense to enable them to keep broadly disseminating our product. But when we think about partnering with cities, counties, communities, school districts, et cetera, we really like to have that direct conversation and direct access to customers because we can then share a really compelling vision. I think probably better than anybody can because it came from our brains, right? And I think there's an element of having that direct access to a customer that's important when you're trying to change the way you do things. And so we think that's important.
Yeah, it's. I mean, when you start talking about cloud-based structures and ecosystems, it would be it would be naive to think that on a grand scale, a distributor is going to be able to communicate that value proposition to the customer in the same way that somebody that's dedicated to that product and
I
like
think
you
that's
said,
right.
whose brain it came from. It's not a knock on the distributor. It's just
Yeah,
it's kind of a fact of circumstance. So that makes
right.
perfectly good sense. So when I saw the device, the first thing I thought was, this is a sexy looking device. It's much sleeker than the other technologies that are out on the market. Was that I'm guessing that was intentional. I can see it right over your shoulder there. I'm guessing that was intentional. If so, why?
Absolutely intentional. And I think I have to give all credit to my co-founders, Rory Byer and Mosley Andrews, and our lead mechanical engineer, our first hire, her name's Priscilla. They were so determined to make the product look, act, talk, feel like what you use, and I'm going to point to my phone every day of your life. Because
Mm-hmm.
making it look like a medical device would only perpetuate and further the approachability and familiarity challenge that we have societally with AEDs today. And that's not a knock on anybody, but they look like and feel like a medical device when you're interacting with them. And again, yes, we are a medical device, but we are a medical device, like Mike, you mentioned, that needs to be able to be used by my 9-year-old cousin, right? If and when it's needed. Like that's the level that we need to be able to get to. And so approachability and the form factor and the look and feel, the UI, the audio instructions, all of that is so critical because when you have seconds and minutes matter in whether someone lives or dies, we have to make the product feel like something you feel empowered to use, you feel encouraged to use. And that was a really important theme for us. And we spent a ton of time, probably more than we should have, on usability.
Yeah.
Did dozens and dozens of usability studies with trained professionals, untrained professionals, kids, elderly, everything you could think of under the sun. And I think some of the data we're seeing in the market with our product in the market is bearing out that that was worth it because the usability has been pretty tremendous.
Yeah, I think I saw. It might have been on your website. It could have been on YouTube, but I saw a video of it on the wall in a home, and
Yeah,
and the device goes off, and the mom runs and grabs it, and she runs out of her
yeah,
house and runs over to another home,
yeah,
to you know to aid somebody who was having
yeah.
cardiac arrest. And when she grabbed it off the wall, it fits nicely in the palm of her hand, and it resonated. It hit home of like, yeah, this is something that could be used very ubiquitously moving forward. So congrats on the design of the technology. It's incredible. This is a leapfrog technology. What I would think everybody would be gravitating towards this. But as with every medical device, there's challenges in driving adoption and utilization. What challenges are you guys experiencing at present?
Yeah, I think with any new technology, it's always about helping people frame the problem and solution in a different way, right? Historically, we've really been about moving boxes. We've placed AEDs on walls and said, "Good job, well done," right? And now I think we're really looking at, can we solve the core problem? And framing it that way for folks. So some folks it's instant, they get it. And some folks it takes a little bit more time to understand the full power of a connected platform and ecosystem versus just an AED, right?
Mm.
And so once you get someone there, it makes all the sense in the world, and it's kind of like, why would I do anything different? But I think that that's certainly a piece of the puzzle, right? Is helping educate the marketplace on, no, we can do more here. It doesn't have to be we just put an AED on a wall. We can actually work on solving the core problem and addressing the pain points you've had for the last 2 decades that have gone unaddressed. And I think that's just a part of an education process as you're building the brand and building the market. And so I think probably, Mike, that's it. And I'd also say, we have a rapidly growing sales force, but we are not everywhere at all times, right? And we are growing the team quickly. And I think that that's always a challenge as you're trying to scale the team and scale the commercial infrastructure, and you're competing against players that have reps in almost every zip code, right? So that's a fun challenge, and we take it on with great energy. But I'd say probably those are the core things that we really think about in terms of headwinds that we gotta tackle.
Yeah, yeah. When you were talking about that, that we could do more, the we could do more issue, and getting customers to that next level, it made me think of HubSpot, and how,
Yeah,
when you start with HubSpot, you're paying $40 a month, and then you see that every dollar you spend, you get 100 or 1,000 back, and the next thing you know, you're spending $8,000 a month for HubSpot
there you
because
go.
you're getting that much value out of it. But it's getting that customer from $40 to $8,000. It's not an easy task, and it takes time.
And
So
and I think, Mike, we don't for a second pretend that we're going to be the most affordable AED out there. We pride ourselves on delivering differentiated value, or unparalleled value, I should say, to our And I think that that's a piece of the puzzle as well, right? Where um, we are more than an AED. We are a platform for how you can think about reframing or rethinking how you respond to cardiac arrest emergencies in your community, on your campus, in your business, whatever it may be. And I think that's something we feel is really important to hang our hat on.
No, it's great, and you led perfectly into my last question, which is, the way I look at these things. This could very easily be a platform technology. This could be a first responder platform. There's so many different avenues you could go down with it. Do you guys have do you have designs for any other additional technologies, any other solutions that that would complement it?
So I won't give, too much of the cards away in terms of how we think about maybe the future, but I will say, Mike, I think you're exactly right that cardiac arrest you can view as possibly just the beginning, right?
Mhm.
There are many acute emergencies that happen every day. Anaphylaxis, uh,
Stroke.
stroke, bleeding out, all these things that you can think of that require acute, immediate, timely response, right? And you could possibly imagine how yes, today we are focusing on cardiac arrest. That is where we are laser focused today. But the software platform and connected ecosystem that we're building has a lot of flexibility, right, in terms of being able to be expanded to other use cases and other time critical emergencies. And so I think as we progress as a company and we continue to establish ourselves and take market share in this space of cardiac arrest, you'll start to see us venture out into some of those potentially other time critical emergencies over time. But today we're gonna go try to save some lives from cardiac arrest emergencies.
I love it. I love it. Yeah, it's a very real problem. We have issues or events like Damar Hamlin, and
Yep.
it gets a lot of attention for a period of time, but it hasn't gotten enough attention for the amount of lives that it takes every year. And so I applaud you guys for those efforts, and wish you guys nothing but success moving forward. Thank you for joining me on the show, and we'll look forward to following you guys as you continue to grow the company moving forward.
Thanks, Mike. Appreciate you having me on.